Hi everyone, welcome to Warwick Medical School's hand examination. Please ensure you follow your own institution's guide for the hand examination, as this may vary slightly.
Hello, my name's Dr. Gill. I've been asked to do an examination of your hands today. Before we start, can you please confirm your name and date of birth?
Anita Kumar, 20th of June 1975.
Super. So before we start, do you have any problems with your hands that you're aware of?
No, I don't.
Thank you. And are you right or left-handed?
Right.
Super. So we're just going to start off by having a look. Can you show me your elbows, please? Okay, so I can't see any issues with the skin there. Just show me the forearms, please. Okay, I'm just going to touch if you don't mind. And there's no evidence of nodules there or lumps or bumps. So if you put your hands out in front, please. So just having a look. Starting off at the wrists, I can't see any obvious swelling, so we've got normal alignment. Over the dorsum of the hands, so there's no obvious swelling, there's no thinning of the skin, there's no obvious easy bruising. The knuckles look fine, there's no inflammation there, there's no changes to the thumb to suggest anything like osteoarthritis. And having a look at the nails, I can't see any brittle nails. There's no evidence of onculitis, any splitting of the nails. I can't see any scaling of the skin, nor evidence of waxiness or dry skin. Looking over the fingers from the side, I can't see any swan neck deformities. There's no Boutonniere deformities. And I can't see any obvious nodes that might suggest rheumatoid arthritis or osteoarthritis. But we'll have a look in a little bit more detail in a moment. If you could turn your hands over, please. So we're just having a look at the palms, and I can't see any evidence of wasting to the thinner eminences. There's no palmar erythema, so redness to the palms either. So I can't see any evidence of carpal tunnel scars. I can't see any obvious thickening, and again, I can't see any changes to the fingers in that regard. So I'm just going to press over your hands if you don't mind. So checking, I can't feel any scars, I can't feel any loss of muscle bulk there. Checking over the palmar surfaces, there's no obvious issues with duplicitous contracture. That's good. So at this point, I'm just going to check for sensation. So I've got a cotton wool bud. I'm just going to touch your chest if you don't mind. So just close your eyes, please. Can you feel that?
Yes.
Super. You don't your eyes. So I'm going to do the same. I'm going to touch your hands now. Please close your eyes and say yes when you feel me touch you.
Yes. 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 Yes.
Superb. That's fine. If you could turn your hands over, please. Okay, same again.
Yes. Yes.
That's brilliant. So just before we go on to do the movements, I'm just going to check the temperatures. Just checking the arms, wrists, hands, and fingers. Everything there seems to be good. With your thumbs in that position, I'm just going to press into the anatomical snuff box. Is there any discomfort there?
No.
Good. And is there any discomfort there?
No.
Fantastic. So if I could get you to keep your hands there, I'm just going to squeeze your hands. Any problems with that?
No.
Superb. So there's no pain there over the MCPs, the knuckles. If you could keep your hands in that position, I'm just going to box around joints. So what I'm doing is I'm looking for any bogginess, I'm looking for any swelling, any nodules, anything like that as I press around. So far, everything feels and looks absolutely normal. That's fantastic. So spread your fingers wide as you can for me. Great. Don't let me move your fingers. Good. Fantastic. And if you can make a fist for me. So we've got excellent gutter into the knuckles. No issues with that. And if you could turn your hands over again. So fingers out. And then once again making a fist for me. So your fingers have gone all the way around to point towards your palms. That's brilliant. And just relax for me. And then take my fingers in your hands. Squeeze them tight as you can. Really try and go for it. Fantastic. So if you just put your hands on the pillow, please. And if you could raise your thumbs upwards, please don't let me push them down. Fantastic. And if you could make the OK sign, please. Please don't let me pull through. Good, good, good. So I'm just going to give you a tape measure, please. If you could extend it for me with your hands. Okay, and cause it to retract. Super, and we'll do the same again on the opposite side. Brilliant, and cause it to retract. Fantastic. So everything looks normal from that perspective. We're just going to go on to do some specific tests with regard to carpal tunnel. So if you could bring your wrists down 90 degrees, we're going to keep things there for 60 seconds. Whilst you've done these, whilst you've had these hands in these positions, have you had any pins and needles to your fingers at all?
No, I haven't.
Super, thank you. So if you want to relax your hands onto the bed. Now I'm going to again see if I can generate any pins and needles by striking with the tendon hammer over your hands. This might feel a little bit uncomfortable. Are you happy for me to proceed?
Yes.
Super. Is that causing any problems?
No.
Super. We'll do the same on the opposite side. Does that cause any problems?
No.
So with both of those, we didn't get any pins and needles at all, anything like that?
No.
So we're just going to have a look at your hands, specifically checking the blood supply. So we can see your hands are nice and red at the minute. If you could squeeze your hands tight as you can for me. 1, 2, 3, 4, 5. And relax for me. Okay. 1, 2, 3, 5. So we see your hands have gone red, they've gone white, and then back to their normal colour. We'll do the same again, starting with this hand. So squeeze your hand tight as you can for me. So tight, 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 tight. I'm just going to take your radial and ulnar arteries and I'm pressing down quite tightly to block them. So open your hand for me, please. Okay, staying white, and I release the ulnar artery. 1, 2, 3, 5, and your hands come back to normal colour. So we know we've got good radial and ulnar supply. If we do the same again on the side, squeeze your hand tight as you can. Tight, 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 tight. Pressing firmly over the radial and ulnar arteries. And relax for me. Okay, staying white, releasing the ulnar artery. And then 3, 4, and the colours come back. So we can see that you've passed Allen's test. We know that we've got good arterial supply on the left and right of the hand. Super. Well, that completes our examination. I haven't found any abnormalities to your hands. Do you have any questions for myself?
No, I don't.
Super. Thank you very much.
Thank you.